Hello, good afternoon, and namaste. This is Dr. Srinidhi Chidambaram here, welcoming you to a Facebook Live session presented by Apollo Hospitals. I'm so happy to see all of you again, and I hope you've been staying healthy and safe. With an upswing in COVID cases in some of the states in India, it's time to talk about COVID-19 again and refresh our awareness and safe practices. And I do hope that you've all been following all the COVID safety procedures without fail. While we have been having the adult vaccination drive for COVID, including the precautionary dose, going on in full swing, we need to now also discuss about the latest advisory and guidelines for vaccinating children and teenagers. So you must have read in the newspapers and media that there have been many vaccines, quite a couple of them, which have been approved for different age groups for children and teenagers, and it's kind of already started. But the issue is that many parents are still hesitating to vaccinate their children due to a lot of myths and misconceptions that are floating around, and also because of reluctance, or somehow it is not yet gained the momentum that it should be gaining. But children and teenagers are the vulnerable group now. They are the ones who have not been vaccinated as compared to the rest of the population. Plus, it's a large chunk of our population in India, the young population. So it's important to talk about it and clarify all the myths and misconceptions. So today we are going to understand what the approved vaccines are for this age group, what are the different types, their mechanisms of action, what is going to be the role of vaccination in this age group, and then also clarify all those misconceptions so that you can give your young ones the gift of COVID immunity. So to discuss this, I'm very honored and happy to welcome Dr. Vijay Yewale. Vijay Yewale is the senior consultant pediatrician and also the head of the Institute of Child Health at Apollo Hospitals, Navi Mumbai. Doctor has more than 28 years of experience in the field of pediatrics and is particularly interested in pediatric infectious diseases and immunization. Dr. Vijay Yewale is experienced in handling newborns, preterms, neonatal and pediatric intensive care, and has been conferred with numerous awards and accolades like the Special Award for Work in Antimicrobial Resistance from the Union Health Minister, honored with the late PM Udani oration at the IAP Maharashtra State Conference. He is also delivered several orations in a similar way in the field of pediatrics and has also several research publications listed under his name. He's been editor of several books and journals, part of several scientific publications and research, and also has been the president of the Indian Academy of Pediatrics, chairperson IAP Infectious Diseases Chapter, a member of the Indian Medical Association, and also a member of the Pediatric COVID-19 Task Force of the Government of Maharashtra, National Neonatology Forum, and many more. So thank you so much, Doctor, for joining us today. We can't think of a better person to advise our parents on what they need to do regarding this COVID-19 vaccination for their children. So let's begin with some words from you about why should children be vaccinated, first of all, against COVID-19?
Very good afternoon, viewers, and thank you, Dr. Srinidhi, for those kind words of introduction. Now, a basic question, why should children be vaccinated? I think it has been proven beyond doubt that it is only because of vaccination that thousands of individuals could be, saved of this deadly infection. The adults I'm talking about. If you recollect, we had vaccine rolled out in phased manner. We had to prioritize, and initially, if you recollect, the vaccines were made available for frontline workers, health workers, then at-risk individuals above the age of 60, and gradually, very correctly, the government has brought down the age, and today the vaccine has been authorized for use even between the very young children between the age group of 6 and 12 years. Now, the vaccine I must talk not about a COVID vaccine, any vaccine for that matter, has been one of the best tool which has had great impact on child survival. It would definitely protect the children against infections like, say, for example, if you use COVID vaccine, the child is protected against a major severe disease caused by COVID infection. At the same time, I must remind the viewers here that a child who is vaccinated, though is protected against disease, is still at risk of contracting infection. However, the infection would be very mild or asymptomatic. And that's why it's a very safe and effective tool is available. And we all must ensure that all the eligible children get this vaccine. Unless we protect our children, the society will not be protected and will not be able to overcome this virus.
So now I'm going to play the role of, the kind of echo what parents and families have been wondering about. So I will just bring forth some of those queries and doubts. So the first thing is, people often ask, why should, because we've been saying all this while the children get very mild COVID, if at all. So now, the thing that you tell them that you have to vaccinate your children. So the question is, why should children be vaccinated if they're anyway going to get only mild COVID?
First and foremost, as the restrictions have been lifted, we have started coming together, schools have reopened, and we know that COVID spreads by a droplet. So these children are at a risk of contracting this droplet or respiratory infections just by surely coming together. And remember, though the pandemic cases have come down, the virus is not out and over. It is still in circulation. So these children, one, can get infected. Two, by and large, though the infection is very mild in children, children have the potential of carrying this virus back home and infect other vulnerable adults or close contacts in the family. Some children, especially those with chronic illnesses, they themselves can develop very severe disease. And not that all 100% children have either asymptomatic or mild infection. There are some subset of children who are at risk of contracting moderate to severe illness, and there is a risk of hospitalization. So, and finally, if we really want to overcome this virus, we need to stop the transmission of this virus, meaning thereby infection spreading from one individual to the other. And unless we vaccinate this vulnerable children, we will not be able to get rid of the reservoir, because these children will continue to serve as a reservoir for the virus, and it will continue to spread even amongst the adults or vulnerable adults. Second important thing that most of the parents ask, that they have heard that the virus has been there for over 2 years, and most of the children have developed immunity by virtue of asymptomatic or mild infection. Do they still need to be protected? Yes, certainly, because you must have seen that we have faced several waves of this infection, and this virus is a very smart virus. It keeps on mutating, and newer forms keep emerging. And even if you have developed immunity by natural infection, mild infection or asymptomatic infection, that immunity does not protect you foolproof. You are still vulnerable to get infected by a new mutated variant of the virus. And these are a few reasons why children should also receive the vaccine.
Absolutely. The other question, which was there even for the adult vaccines, is that, were they developed too fast? And, have proper safety trials been undertaken?
Well, I can imagine there is a reason why people ask this question, because a routine vaccine goes through several stages of development, and it takes almost a decade for any vaccine to hit the market, right from the research stage, proof of concept, to finally being introduced for use on human beings. However, we were in an unprecedented situation where we had to develop a vaccine, fast track all these safety processes that a vaccine undergoes, and roll it out as an emergency tool. However, no compromise is made on safety of any vaccine used in human beings. And that is how all the trials were initially carried out in adults, The vaccine was licensed, what is known as emergency use authorization, given the unprecedented situation that all of us were in, and the vaccine was used in adults. Having said that, this vaccine subsequently simultaneously was also undergoing trial in children, and only after ensuring that the vaccine is safe in children in different age groups was emergency use authorization granted for use in younger age group. And today we have these COVID vaccines approved for use in 18 to 15 years, then 15 to 12 years, and now even for children between 6 and 12 years of age. So remember, no vaccine is allowed to be used on human beings unless it is found to be very safe in clinical trials.
Absolutely. Another thing is about the news items or stray items that might have appeared with people having the vaccine and then developing certain complications. So there has been this query whether this causes myocarditis and affects children's hearts.
Well, vaccine, like any other medication, has a potential of causing adverse effect. However, till date, the vaccines which are available for use in India have not caused any serious adverse event or side effect. Very often we get to hear about the myocarditis that Dr. Srinidhi has very correctly brought out. This has been found as a very, very rare side effect with the mRNA vaccine, which has been used in the Western world. Remember, this vaccine is not used in our country. We have two vaccines which are approved for use in children. One is Cobaccin, the wholesale inactivated vaccine, like your influenza vaccine. This vaccine is authorized or licensed for use in children. And the second vaccine is Corbinx, which in medical parlance is called as subunit vaccine. If I were to give you a simile, the hepatitis B vaccine that your children receive, it is similar, very much similar to that. So it is the antigenic component, important component of the virus, which is used to induce immunity by making use of it as a vaccine. So both these vaccines have been found to be very safe in children, and there are no adverse effects which have been reported so far. So be rest assured that this vaccine is safe for use in children. Those myocarditis reports, first of all, they are extremely rare and have been reported with the mRNA vaccine, which is not used in our country.
Even the neurological complications, I think, are with the mRNA vaccines only.
Yeah, absolutely.
There's also this other thing that, especially not that we have I think the zycov-d is a DNA recombinant vaccine. So there was this initial worry about, when they hear the word mRNA and DNA and all, whether, there is some chance that, this would affect the genetic makeup of the recipient.
Well, first and foremost, we should pat ourselves because it is the Indian company which has developed this first of its kind DNA-based vaccine. And this vaccine, there are lots of rumors and myths about it, that this vaccine DNA gets integrated into the human genome and DNA and creates havoc. Please don't believe in such rumors. The DNA vaccine, which also has been granted potential emergency use authorization, is also extremely safe vaccine. Initially, it was tried out in 3-dose schedule, and subsequently, the number of doses that would be required has been brought down to 2. And very soon, we will have even the DNA vaccine rolled out for use in children. So please be rest assured that these vaccines, unlike the rumors that have created some misunderstanding and myths amongst the minds of people, that they get integrated to the DNA and lead to several side effects, are absolute myths, and there is no fact in it.
Sure. So are there, other, what are the long-term side effects, or is it just that, they're very rare and at the most there might be some arm pain and mild tiredness and body pain, fever in some cases? How is it with children? What are the side effects?
So as I said before, like any other medicine or any other childhood vaccine, these vaccines do have very minor side effects. Like some children may experience pain at the site of injection, some redness, A child may have once in a while fever, but all these are mild symptoms. And theoretically, in the long run, some vaccines can have some side effects which are yet unknown to us.
Yes.
However, I repeat that we are more than 2 years into using these vaccines on in adults, and there have been no, warning signals, and the vaccines have been found to be pretty safe. So please once again repose your faith in these vaccines, and vaccination or vaccine is birthright of every child, and the
Yes.
onus is on us to spread this awareness and dispel myths and ensure that most of the children or all children, eligible children, get this vaccine, and we are able to conquer over this virus.
Absolutely. So, talking about eligibility, are all children eligible, or and also is that it's kind of like how we had Covishield and Cobaccin? Are there any choices being given for each age group, or is it going to be like, this age group takes this vaccine, or is it
That's a
also going to be regionally different across the states?
So that's a very important question. If you remember, we went down lowering the age limit, and the first vaccine which was approved for use in the age group 15 to 18 was Covaccin. And it is the Covaccin which is being offered to this age group children. Subsequently, for the age group between 12 and 15 years, it is the Corbevax or the subunit vaccine which has been approved and has been rolled out. Both Corbevax and Covaccin have received emergency use authorization, and I am informed that May 3rd onwards, this vaccine will be rolled out for use in younger children as young as 6 years of age. So you have different vaccines in different age groups. Covaccin for the age group 15 to 18, Corbevax, the subunit vaccine between the age 12 and 15. And when it comes to younger than 12 years, up to the age of 6 years, we have both the Covaccin as well as Corbevax. But in this age group, the vaccines are yet to be rolled out for use on children, and that would happen very soon.
I think it was just recently announced that the
Yeah.
authorization. What about the other two vaccines, Doctor? The zycov-d, and also there's another one called Covovax, I think. They are not right now.
The zycov-d has received approval, and so also the Covovax. Now, Covovax is again a subunit vaccine which is similar to your Corbevax, which is manufactured by Serum Institute of India, and that also has been granted emergency use authorization. And as we expand the base, more and more vaccines would be available so as to cover the entire population. Yes, but I repeat, all these vaccines are extremely safe, and hence parents should have no hesitation whatsoever in their mind and go ahead and vaccinate their children and protect them against COVID.
Do you think that the children also will require a booster or a precautionary dose, or right now is it just the 2 doses that are given?
Well, answer to this question as of now is really not known. But what is recommended today is 2 doses. And it's only with time, as the virus emerges, as the more and more mutations arise, and as we understand the disease epidemiology, that we would be able to be in a position to recommend or to say if a booster dose is required by children like adults. But as of now, it is being rolled out as 2 primary doses in children.
Also, is it that, is there any contraindication to, are there any children who may not be eligible, as in, like, are there conditions that could make them ineligible, or it's contraindicated for them?
Well, for all practical purposes, there is no contraindication unless there is a severe life-threatening anaphylaxis to any of this vaccine in the past. Then one would be cautious before administering the second dose. However, most of the parents feel that a parent may feel that his child has some chronic, debilitating disease, or has some congenital abnormality, or has some deficiency in the immune mechanism or immune system, whether such children should be given or not. The answer is these children are even at a higher risk of contracting moderate to severe disease. And these are the very children who require protection much more than your normal children. I repeat, not that normal children don't need to be protected, but what I'm trying to impress upon you is these are the children wherein a common man would think that they are not safe to take the vaccine. However, it's contrary that these children are at a risk of severe disease. They should be protected first.
Is it also true that some of these vaccines in adults, they were causing some menstrual disturbances? I think it was the Covishield.
Covishield was the vaccine which, in again, extremely rare side effect of blood clotting. But that also has been reported in one in several million cases. Such side effects are a potential side effect which is not really children are not really at a risk of such a side effects. And more importantly, it is not the Covishield which is offered to children. It's the other vaccines, Covaccin and Covovax or Corbinx, which will be offered to children.
There are just a couple of questions which are coming to us from the live feed. So which is a better vaccine, Corbinx or Covaccin?
I said Covaccin and Covovax, both are safe.
No, Corbinx or Covaccin, sorry.
Corbinx and Covaccin. So let me explain to you once again. Covaccin is the whole virus which is inactivated, whereas Corbinx utilizes that part of the virus which is responsible for causing disease and which is responsible for producing immunity or defense in our body. Both the vaccines have been found to be safe and effective, and as I said before, it is available for use in different age groups. For children between 15 and 18 years, it is the Covaccin which has been approved, and for children between 12 and 15 years, it is the Corbinx which has been approved. Both are equally safe.
My brother's child is having fever since past 2 days. Should we get him the vaccine now or should we wait for him to get well?
See, though these vaccines are extremely safe, it is not super urgent. Like any other vaccine, if a child is down with some acute illness, let the child recover, and as soon as the child recovers, he should be offered this vaccine. Because these acute short-lasting fevers or acute illnesses are not really significant enough to interfere with a good response to the vaccine that is offered. So soon after the child recovers from the fever, this child should be offered the vaccine.
The last question is, how many doses of vaccine is suggested for the children?
So as of now, 2 doses have been recommended at an interval of 28 days.
So is there anything else that you would like to tell our viewers, Doctor?
I would again reiterate, please don't believe in rumors and myths. COVID vaccines have been found to be safe in children. For that matter, unless the vaccine is found to be extremely safe, it is not licensed or allowed to be used on human beings. Very correctly, we have prioritized use of this vaccine starting from elderly above 60 years of age to immunocompromised adults. And now we have come down to a stage where we are in a position to offer this vaccine to children. The schools have opened up, the restrictions have been lifted. There has been some, lapse in following the non-pharmacological measures like wearing masks, avoiding crowded places. So the risk of, increased circulation of this virus is again there. And I'm sure all the viewers must have been reading in newspaper that there is a bit of rise in COVID cases all across the country, more so in a few states. And given this situation, when we have very safe vaccines available, which have been authorized and licensed for use in children, why not offer them to these children and protect not only the children who receive the vaccine, but also protect the susceptible adults or adults with, chronic debilitating disease who can at a potential risk of contracting infection from these children. And remember, adults who have suffered COVID in the past have survived mainly because they have received the vaccines. So vaccines have definitely proven their worth, and adults who have survived, survived following natural infection or vaccination, are still vulnerable to get infected by a new mutated strain. And hence, unless we vaccinate the children, we will not be 100% protecting this close contact adults also, wherein the children, whether the disease is much more severe as compared to children. So please vaccinate your children with the available vaccines. Contact your health authorities or pediatricians and get your children vaccinated.
Thank you so much, Dr. Vijay Yewale, for this wonderful discussion. I'm sure that your valuable insights would have helped our viewers to understand the role of vaccines in protecting our children from COVID. So viewers, do register your kids for vaccination if they are eligible. Remember that the tools of COVID-19 protection are all in your hands. So whether it is the safe masking or the hand hygiene or the vaccination, you know it, so you have to do it. So be safe, be well, be alert. Thank you and namaste.
Thank you. Namaste.